And the last time we discussed the this part. This is relevant part where we discovered the findings of Foria's or latent squint on cover and cover test. We said that we can cover either eye because either eye is a fixing eye, and we have to see what happens when we remove the cover. So that is the uncovered test. Now, if the covered eye it moves after removing the cover, meaning that there is a recovery movement and it moves immediately, then we know that the patient has a latent squint. And if it does not move, meaning that it remains deviated for some time, after that it moves, it's an intermittent squint. Intermittent squint means that the deviation, it remains for some seconds and afterwards it corrects. So it's basically, you can say, halfway between latent squint and manifest squint. It's approaching manifest squint. But even if we do not find anything on the uncovered test, we can perform an alternate cover test, as was done in the video which I sent you. So if there's no movement on alternate cover test, there will be no squint. But if there is movement, it will either be a latent squint or an intermittent squint. And then if the movement is immediately, it's latent squint. And if it's not immediately, if it's after some time, then it's an intermittent squint. So if you understand this whole flow chart, then the diagnosis of squint will not be any difficult for you. सारी कहानी squint को diagnose करने के लिए इसमें more or less दी हुई है. So we discussed the tropia part in last sessions. Let's move on and discuss our case for today. And but before we discuss the case for today, let us see this video. ये video देख लेते हैं जल्दी से. So I'm not sure कि कितना lag हो रहा है दरम्यान में, and if it's cut के तो नहीं आ रही और it's laggy. If it is laggy and it's no use of seeing this video, then we'll skip this completely because you have seen the video and you also know the diagnosis in this patient. मैंने कहा था थोड़ा discuss कर लें. If you're able to see it properly, तो बता देना. We'll continue. Otherwise, it's a waste of time. हम फिर case की तरफ चल पाएंगे. ठीक है? Yeah, 16 parts code. So, at first time, she covered the left eye. Okay, she covered the left eye. Let's move back for a second. She covers the left eye. There is no movement in the right eye. Okay, the right eye does not move. So, other. Now she removes the cover in the left eye, and as she removes the cover, we can only appreciate a mild movement in the left eye. So we might be thinking, all right, the left eye might have a squint. Movement was inwards, so she might have an esophoria. Let's see what happens when she covers her right eye. Left दोबारा cover करें, all right. So as soon as the cover is removed, she blinks her eyes, and they're both straightened again. We're not able to appreciate the recovery movement this time in the left eye. ठीक है, note these things as we're moving along. Again, so there is some recovery movement in the left eye. Again, when she covers and uncovers her right eye, the right eye has an inward recovery movement. ठीक है. Again, she covers her right eye. And again, the right eye has a slight recovery movement. Okay? Look at that. She has a slight recovery movement of the right eye. So up till now, हमें लग रहा है कि दोनों आंखों में exophoria, somehow like it's an alternating exophoria in both the eyes. अभी तक हमें ये लग रहा है. ठीक है? So after performing the cover and cover test a few times on the right eye, she now decides to perform an alternating cover test. Let's see the alternating cover test. So in the alternating cover test, you're able to appreciate that whichever eye fixes, for example, now the left eye is fixing. And she will remove the other eye, this cover. The other eye will make a recovery movement medially towards the nose. Okay, like this. This eye moved medially. So it made a medial recovery movement. Again, Now, when she removed the cover of this eye, you were able to see that this eye, it made a medial recovery movement. Okay. So what does this patient have? This patient have an exophoria. अब आप पूछ रहे होंगे किस आंख का exophoria है? Does anyone know किस आंख का exophoria है?
ऑल्टरनेटिंग है क्योंकि दोनों आईज ही फिक्स कर रही हैं.
दोनों आईज फिक्स कर रही हैं, राइट? तो दिस इज सम कंफ्यूजन. तो अभी हम इसको थोड़ा सा कंफ्यूजन को साथ लेके अपनी चलते हैं. विल डिस्कस दिस लेटर ऑन, बट एट लीस्ट एवरीवन मस्ट बी श्योर कि दिस पेशेंट हैज एन एक्सोफोरिया. जिस आई में भी है, इट्स एन एक्सोफोरिया बिकॉज द रिकवरी मूवमेंट इज बीइंग मेड इनवर्ड्स इन बोथ आईज जब भी हो रहा है. ठीक है, लेट्स टेक अ लुक एट द ऑल्टरनेटिंग कवर टेस्ट अगेन. So it's an exophoria. We're able to see on the alternating cover test that when she's predominantly fixing with her left eye. Okay, because between some alternating covers, look at her left eye. अभी deviate हुई है. दोबारा एक बार देख सकते हैं. Look at her left eye. It hasn't deviated now. अभी deviate हो रही है. So in some of this, from the start, if we can see, let's just focus on the left eye. Deviation. Not able to appreciate much. Outward deviation remains central. अब deviate हो रही है. तो she seems to favor her left eye. तो कौन सी आई में squint है हम वो डिस्कस कर लेते हैं. We will discuss this at the end. Do remind me to discuss that we should discuss the video at the end. तो हम अभी तक क्या हमें समझ आई है? We've seen that this patient has an exophoria. We're not able to appreciate in which eye the exophoria is, but we know that it's an exophoria because the eye, when the eye under cover makes a recovery movement, otherwise there is no recovery movement. So, ये था exophoria की थोड़ी सी cover and cover test और alternating cover. Okay, let's discuss the case and we'll come back to this video again at the end of our case. So read the case. Let's discuss the important points in the history. And then we will discuss the management and what we would want to do. साथ ही हम पैथोफिजियोलॉजी देख लेंगे. So, what are the important points in the history of this patient? Let's see. इसको मैं नीचे ले आता हूँ. So what are the important points in the history of this patient? First important point is the age. 10 years old. The child is 10 years old. That's an important clue. It helps us a lot. आगे हम देख लेते हैं. Age, yes. So he presents to us, he's a he. So he presents to us with strain in his eyes. What is the medical term for strain in eyes? It is asthenopia. Yes, asthenopia. So this child presents to us with strain in eyes, which he says begins after reading or writing after an hour or two, when the letters seem to run together. Now this is a very peculiar symptom. Okay? It's a very big description. You're right. No, you're wrong. Heterotropia. So Faria has given us a diagnosis at the start. हम इसको दोबारा end पे discuss कर लेंगे. So crowding, not clouding. So he notices this happens to him at night. What have we understood from the history? Let's make sense of the history. Okay, our patient is 10 years old. His chief presenting complaint is strain in his eyes or asthenopia. That is his presenting complaint. What is the history of presenting complaint? The HOPI or the HOPC? He says that his strain begins after reading or writing for an hour or two. after क्या चाहिए था grammatical error, reading or writing for an hour or two, where the letters seem to run together, and this happens at night. So he says that come night time, शाम के वक्त, रात के वक्त, after and during that time he's been reading or writing for an hour or two, घंटा तो वो पढ़ रहा है या कुछ लिख रहा है, and after this activity progresses to for an hour or more than an hour, he notices that the letters in his book or his tablet, whatever the text he's seeing, the letters, they seem to run together, meaning that they are jumbled together. And due to that, he is experiencing strain in his eyes. He is experiencing asthenopia. So this history is a very typical history, okay, and it tells us a lot of stuff. It tells us the pathophysiology of what is happening. We'll discuss that pathophysiology, but first up, we need to know how we should work up this patient. Latent. Yes, it's latent. So it's Esophoria. It's not atropia. Okay, but how do we know it's latent? मैं कह रहा हूँ कि latent नहीं है, हो सकता है atropia भी हो. We cannot know for sure until we work up our patient. So what is the first thing which you would like to do in this?
Check the visual acuity.
Yes, you would like to take the visual acuity, and visual acuity under cycloplegia. This is a concept I've touched, but it's very important. We'll also discuss this after we discuss the case. Right? Visual acuity and cycloplegia tells us the patient is hypermetropic. He has hypermetropia, and his hypermetropia is, let's say, it's 2.5 diopters in both eyes. 2.5 diopters, both eyes. What else would you like to do in this patient?
Extraocular movement.
Yes, you would like to perform extraocular movements. They help us differentiate whether the squint is comitant or non-comitant, because we discussed at the very start, we have to know that because the etiologies or the cause of the lesion is at a different level. So extraocular movements are comitant and normal range. क्योंकि दोनों आंखों में बराबर हरकत हो रही है, हलचल हो रही है और रेंज भी नॉर्मल है. What else would you like to perform?
Refractometry.
क्या परफॉर्म करेंगे?
Refractometry in order to find out the refractive errors.
Refractive error. Retinoscopy के साथ, right? So visual acuity हमने बहुत broad term में ले लिया है, but you're right, I should have written it down. Visual acuity can be done by retinoscope, and since this child is able to read and write, we can also use a Snellen's chart, and we also use a refractometer or an automated refractor. Okay? So these are the three methods by which we can check the visual acuity. So thank you for clarifying that and letting me know. So we've done the visual acuity, we've done the extraocular movements. Keep that flowchart in mind, and what is the next thing we need? Keeping that flowchart in mind. माना कि काफी ऐसा हो गया, we have had a 5 days pause, but I don't think that your memory is so weak that you don't remember the third step.
Hirschberg.
ठीक है, Hirschberg says, you know that our patient shows some signs in which they're studying squint. और सारे algorithm में Hirschberg is very important because it tells us whether there is a manifest squint or not. So Hirschberg is centralized in both eyes. इसका क्या मतलब है? No manifest squint. What would you like to do next?
Cover and cover.
You would like to perform a cover uncover test. So after you perform an uncover test, you see that uncover right eye. क्योंकि cover uncover की दो parts है ना? After you cover the eye, you also uncover it. So when you perform the uncover test on the right eye, there's a recovery movement. Outwards. So what does this mean?
Esophoria.
What does he have?
Esophoria.
He has an esophoria because the recovery movement is outwards in the right eye. So on the basis of that flowchart, we have found out that our patient has right esophoria. हमारे patient को esophoria है. Because this patient, esophoria का मतलब है, this patient does not have a manifest squint, but he has a tendency of disalignment, of malalignment of his visual axes, but that tendency is kept in check. It's kept corrected by fusional capacity, by fusion. So these four tests they
भाई
help.
cover and भाई cover and cover तो tropias के लिए नहीं करते हैं?
कवर एंड कवर ट्रोपियास के लिए भी कहते हैं, कवर एंड कवर फोरियास के लिए भी कहते हैं. दैट इज व्हाई वी हैव टू नो. इसलिए हर्शबर्ग्स हम पहले परफॉर्म कर लेते हैं ताकि हमें उसकी अंडरस्टैंडिंग में इजी हो जाए हमारे लिए. सो लेट्स विजिट दिस फ्लो चार्ट अगेन, बिकॉज इन हर्शबर्ग्स टेस्ट इफ देयर इज नो ऑब्वियस स्क्विंट, तो यानी कि हमें ये फॉलो नहीं करना बात, वी फॉलो दिस पाथ, राइट? एज वी सॉ इन द वीडियो, we can cover either eye. So एक आंख कवर हो जाती है तो दूसरी आंख या मूव करेगी या नहीं मूव करेगी. हमने कहा कि अगर मूव करेगी तो it means that there is a tropia which we were not able to pick on the Hirschberg's test. ठीक है, अगर मूव नहीं करती तो जिस आंख को हमने कवर किया था हम उसके ऊपर से उसे अनकवर करते हैं. तो we come to this part. अगर अनकवर करने पे नीचे कोई मूवमेंट नहीं आती तो then we move to the other eye and we repeat this whole process. By doing so, we can detect phorias as well. So in this video, you can see that this patient did not have any manifest squint. She had a phoria, and we were able to pick up it was an exophoria on the cover tests, cover and the alternating cover tests. So I've also shared a link of the videos जिसमें वो cover and cover perform करते हैं phorias के लिए in the group as well. आप वो लास्ट में एक बार दोबारा देख लेना. So based on the flowchart and just a few clinical procedures, we found out that our patient has esophoria and the right esophoria. What are the investigations which we would like to perform? क्या हम देखना चाहेंगे? ठीक है, चलो. Let me put this question in another way. Now you know that our patient has an esophoria. What is the treatment for esophoria? How will you treat this patient?
First of all, application
Refractive
of
error को correct करेंगे, hypermetropia को correct.
the lens.
Yes, that is good. So the first, and always remember that whether it's a tropia or it's a phoria, it's comitant and there's a refractive error, you have to correct the refractive error. So correction of refractive error, it always helps a lot. Especially if the squint is related to the refractive error. So that is a good principle of treatment. We have to correct the refractive error. What else would you like to do?
We're gonna guide her that she should perform the fusion exercises.
Fusion exercises, right? So we have to strengthen her fusion exercises. Fusion exercises are very simple. You might have seen them, and we also, I think, discussed them in one of the sessions. Basically, you take a pencil in front of your eye, you keep your head stationary and fixed, and you move the pencil further and then closer, keeping as much focus on it as possible. That it helps strengthen the fusion, binocular vision. Fusion exercises. So these fusion exercises, we have discussed one method of performing these fusion exercises. Okay, that is the pencil exercise. It's pretty straightforward. A pencil exercise, so it's understandable what you mean. Yes. How else do you think can we train fusion exercises?
Occlusion.
Occlusion. So someone said occlusion. How does occlusion help with fusion?
By fovealization.
Fovealization. So you're thinking that fovealization हम करेंगे तो occlusion help करेगी. So let's step थोड़ा सा हम पीछे आते हैं and let's explore this concept. So this patient has aphoria. Aphoria का मतलब ये है कि when fusion is present, there is no squint. We have to break up fusion. हमें fusion break up करने की जरूरत है ताकि हम squint को manifest करवा सकें. ठीक है? This should be clear to you. This statement which I've just said. So fusion, as we remember, as we recall, it is the second grade of binocular vision. The first grade is simultaneous macular perception. The second is fusion, and the third is stereopsis. अच्छा, अब occlusion हम क्यों कराते हैं? We want to stimulate the macula. We want to stimulate the fovea. We want to make it active. That is why we do occlusion, and we want to treat amblyopia basically. So if this person has fusion, if this person has grade 2 binocular vision, do you think they will also have grade 1 binocular vision?
Yes.
Yes, they will have grade 1, and grade 1 is simultaneous macular perception or normal retinal correspondence. So if the retinal correspondence is normal, meaning that both the fovea are stimulated at the same time, do you think in such a patient we should be performing occlusion?
No.
No, we do not perform occlusion in such a case because there is no amblyopia. If there were amblyopia, we would not have good binocular vision or at grade 2 binocular vision. हमारे पास grade 2 binocular vision ना होता. Okay, so this patient does not have amblyopia, so we will not be performing the occlusion patching therapy, the third O which we discussed in the treatment of tropias. So again, my question is, apart from pencil exercises, how can we train fusion?
Orthoptics.
Orthoptics. Now you've said the term orthoptics. What is orthoptics? क्या होती है orthoptics?
Retinal.
It's a normal condition of eye दोनों visual axis एक ही
ये काफी मसला हो जाता है when I ask a question and two people simultaneously जवाब दें. तो I'm going to assume both of you said the right thing because I know you're intelligent enough. So yes, orthoptics is the training of binocular vision or the training of fusion using a synaptophore. थोड़ा सा हम different terminology है orthoptics. We will not per se use orthoptics because this patient does have binocular vision. तो हम कह भी सकते हैं थोड़ा सा gray area. My knowledge is lacking, but I'll still write it down. You're right, orthoptics. So how did we perform orthoptics? कैसे हमने orthoptics की थी?
Synaptophore.
Yes, we used a synaptophore. So basically, the important thing is we can perform fusion exercises using synaptophore. So this is still a gray area for me. I'm not sure कि synaptophore पे training को तो orthoptics कहते हैं. Fusion exercises को भी शायद कहते होंगे. थोड़ा सा मजाक कह रहा हूँ सरी मैं. I'll read upon it. So we have found two methods. The first is pencil exercises. The second is orthoptics. There's still a third method by which we can train fusion. And what is that? It was discussed in the video, if you remember. Prisms, that is good. We will use prisms to train binocular vision. How will we use prisms to train binocular vision? That is my follow-up question. आपका वाइवा चल रहा है, मैं वाइवा ले रहा हूँ.
We will first assess the degree.
One person at a time. एक बंदा एक साथ बोले. एक बंदा.
We will first assess the degree of the deviation.
Yes.
I mean the strength of the diopters.
All right. So, ठीक है. So you're saying that in order to use prisms for treatment, the first thing is we need to assess the degree of aphoria. That's correct. क्या होता है? अच्छा, so you were saying that in order to use prisms, we first need to assess the degree of aphoria, right? That is correct. एक और जवाब आ रहा था कि how we will use prisms. That answer is welcome. No answer? Chalo, koi nahi. So yes,
Spectacles में
spectacles में, yes, you will use prisms in spectacles. Prisms in spectacles. So just now we've discussed two important uses of prisms. The first is that we can use prisms in order to assess the degree of phoria. And the second is we can use prisms in spectacles. Why? So that we can exercise fusion and we can correct that tendency. We want to eliminate that tendency and it can be done using prisms. So a big question mark over here because these are things we need to discuss. And treatment adhuri mein chhodna nahi chahta. So what else would be a treatment modality in such a patient?
Ocular surgery?
Ocular surgery, that is correct. Ocular surgery. So we will perform the surgeries which we discussed, the recession and the resection on this patient. So let's make sense of this khichdi jo humne abhi paka li hai. Let's make sense of this, right? How can we use prisms and spectacles? Why? How do we assess the degree of phobia? So based when we followed that flow chart, we did these first four examinations and we were able to reach a diagnosis. Now, there's another investigation we need to do because it's important for us in treatment. The degree of phoria हम कैसे assess करते हैं? Using prisms, we perform the prism cover test. So as a prism cover test is performed in this video, let's discuss, let's see the prism cover test and let's then discuss what a prism cover test is. So where is the prism cover test? Yeah, this is a prism cover test. So yes, what is happening over here? It's a prism cover test. So by हमें समझ आ रहा है, one eye is being covered by prisms and the other eye is being covered. So it's a prism cover test. What do we see in prism cover test? Basically, and these are prisms of different power. This is a low power as this bar is moved downwards. So higher power prisms will be in front of the eye, and the apex of the prisms is in the direction of the squint. So this patient has had an exophoria, so the apex will be outside, outwards hoga squint ka. Basically, what we're seeing for, we want to judge how much deviation there is or how much tendency of deviation there is. That is the first thing we want to judge, and the second thing is we want to judge the fusional capacity. अब आपको पता है कि prisms का हमने mechanism थोड़ा सा discuss किया था in the last time around, that they divert or they deviate light. We want to see how much the eyes are capable of maintaining fusion under these prisms और किस हद के बाद जाके टूट जाती है. So the second thing, the measurement of the fusional capacity isn't per se being measured over here. We're just saying the tendency of the deviation. Okay, just give me a moment, please. So let's see the video and let's see what happens. So as she removes the cover, she's performing an alternating cover test. So the right eye, you can see that the left eye is always focusing and the right eye has recovery movement, still recovery movement. अभी भी हुई है, अभी थोड़ी कम हो गई है लेकिन हुई है, हो रही है अभी भी. And now we are not able to appreciate a recovery movement. अभी भी नहीं हो रही recovery movement, and अभी भी नहीं हो रही या मुझे नजर नहीं आ रही. इसको तो दोबारा देख लेते हैं. But I was able to see an recovery movement in the opposite direction. Yes, now there's a recovery movement in the opposite direction. So let's see this again. I wasn't able to appreciate recovery movements for some time. That is why they always keep continuing with the prism bar errors. So even if you're not able to appreciate when the recovery has been neutralized, अगर opposite direction में recovery हो गई है, तो आपको एक information मिल जाती है कि all right, the prism I'm using right now is of too much power. So gradually the power of the prisms is increasing and the recovery movement is decreasing. थोड़ा सा इसको पीछे से दोबारा एक बार देख लेते हैं. So there's a recovery movement inwards. It's being minimized. Now from here on now, yes, there's a recovery movement over here. अब हुई है? अब नहीं हुई. So it's been neutralized over here. It's still neutralized. And what happens now? The recovery movement is somewhat, if you can appreciate it, it's been reversed now. Yes, it's now reversed. So she moves 2 or 3 prisms downwards again, where the recovery movement was completely neutralized. So जिस prism पर recovery movement completely neutralized हो रही थी, that was the angle of deviation. Okay, that was the tendency in terms of prism diopters, or in terms of just simple angle, something right कह सकते हैं. So by using the prism bar cover test or the prism cover test, we can assess the degree of phoria. So this is an important thing, important concept which you have to keep in mind, that using the prism cover test, we can assess the degree of phoria. That is the first conclusion. अब हम क्या कहते हैं when we using prisms in treatment? We know that let's say that this we put in different prisms in front of the patient, and let's take an arbitrary number x. This x is an arbitrary number, and at x prism diopters, the movement was neutralized. What can we do? We will put a prism of power x in the spectacles along with the refractive error. जो refractive error की correction करनी थी वो तो हम करेंगे, साथ हम एक prism भी लगा देंगे उसकी spectacles में. What will be the power of that prism? We judged the power of the prism using the prism cover test, and it was x. So we will use this power prism in spectacles to correct the tendency which was present. That is how we will use prisms in prism cover test and prism in spectacles. So by now, this should be clear to you that prisms are used in the assessment of the degree of deviation. ठीक है, हमें prism से पता लग जाता है कि कितनी degree of deviation है in both phorias and in both tropias. However, we only use prisms in treatments in phorias, in latent squints. We did not discuss the use of prisms or the role of prisms in the treatment of tropias. So prisms are used only in the treatment of phorias. और वो भी अभी नहीं कहते, prisms are not preferred, but they are still a treatment modality. Why are they not preferred? Because I'm not sure of the reason why, but in textbooks it's written that by using prisms of these high powers, the tendency is further exaggerated. What is the pathophysiology behind them? I don't know. But I do know the pathophysiology of why this patient who has hypermetropia has developed an esophoria, and together with these symptoms. So there's 1 minute left. I'll be back in a minute. But till then, आप लोग अपने ज़हन में खुद सोचें कि why does this patient who is 10 years old, he developed esophoria? What is the relationship of his refractive error to his esophoria? And how is this refractive error, which is causing this esophoria, lead to these symptoms? Why are these symptoms occurring? So brainstorm on this. I will be back in a minute.